So I had a bit of a rough day in dental school today. It was nothing crazy out of the ordinary. Sometimes days are difficult and that's just the way things are. But it's funny because I've been planning on making this video for a while, and it just so happens that the same day that I kind of have a bad day and things go wrong and generally it's just not my best day, lines up perfectly with the video where I wanted to talk about some of my favorite moments from dental school. For those of you who don't know me, my name is Steven and I am a fourth year dental student. I'm about to graduate from dental school in just about a month and a half. So the past 4 years have held with them just a variety of experiences, some good, some bad, and a lot in between. Honestly, over the next couple of months and moving into the future, I will be talking a lot about my dental school experiences because, especially now that I have a little bit more time to put into YouTube, there's a whole lot of things that I want to get into with all of you. Most of you are pre-dental students or young dental students, and so you're interested in the profession, you know, you're devoting your own time to it. And I think most of you watch my videos because you want to get an idea about what this dental school experience is really like. In 4 years, I have experienced so much. It's been highs and lows to the max. And people always say stuff like this about whatever experience it is, but that truly has been the case for me. Some of the things that have happened in dental school have been amazing. Some of them have been not so amazing. But today I really wanted to focus not on how bad my day was, but rather on 3 moments in dental school where it just all felt worth it. And it all felt like this is the right place for me. I'm doing the right thing and I'm just so blessed. So let's get right into it. The first moment that I experienced in dental school where it all just clicked and felt right for me is actually gonna be all the way back 4 years ago when I was a first year dental student. Now, I made a video about what I'm about to talk about. So if you're interested in hearing D1 me dive into this topic when things were a lot fresher on my mind, check it out right here. It's a lot older of a video of mine, so not produced quite as well, but that video was super fresh on this topic, and I want to kind of look back on it because it really did have a big impact on me. In our spring semester of D1 year, we had anatomy, which was gross anatomy, one of the biggest classes that we take in dental school. And along with gross anatomy was the gross anatomy lab, where we got to actually do a full dissection on a human cadaver. And what an experience this was. Everything became very real for me the first day that we had that anatomy lab and I walked in and saw all the tables with the bodies on them. Once again, check that video out if you're interested in all the details. But that was kind of the first moment in dental school when I really felt like I'm studying to become a doctor. There are a lot of moments in dental school where you feel like you're kind of doing the same thing you've always done. You're studying just like terminology and systems and all of these things, and it's just a ton of information, and it doesn't always feel like you are really studying to become a doctor. Like sometimes it just kind of gets washed out a little bit and you just feel like you're generally studying. But actually going in and doing a dissection, holding a scalpel blade in my hand and cutting on human flesh, as macabre as that is and sounds, it was the first experience in dental school where I truly felt like, man, I'm really doing this. Like I'm going to become maybe not an expert on the entire human body, but someone who has been licensed to treat the human body in one way or another. And it was just eye-opening for me. I actually remember one of the first days that we had lab. I was walking to class. I was walking to lab across campus. I had my UT scrubs on and it was a nice crisp winter morning. And I remember just kind of like looking down at my scrubs, had my backpack on, I was walking to class, and it hit me like, I am really a dental student. Like this is really happening. The thing that I looked forward to for so many years, just coming here and being a student and making it to this point, like I'm literally here right now and it's happening. And it even gives me chills to this day because this just means the world to me. It means the world to me to be able to pursue this career and to do it in my home state and all of the emotions that go along with that. It kind of all clicked for me. Sometimes we have to step back out of the scenario that we're in and just look at the big picture and say, man, I'm so thankful to be where I'm at. Even if you're not in dental school is your aspiration. If you're just in undergrad and you're working hard every day, take a step back and realize like you are on the journey. You're along the path. You may not be as far along as you want to be, but you will get there. And what a blessing it is to be where you're at right now. So D1 year and doing anatomy lab and just starting to learn the human body and having the honor of being able to work on a human cadaver. I was actually talking to a patient recently whose wife passed away and she donated her body to a body farm to be dissected. And we were talking about what an honor it is as a student to be able to learn on a human cadaver. There are just so few people in the world that ever get that experience. So basically, I ask you, when you get in that scenario and you get to work on a cadaver, take it all in, make sure that you're being a good, diligent student, make sure you're being respectful of the person who donated their body to you. Try to learn as much as you can and enjoy it because it really is an amazing moment along the journey in dental school. All right, let's fast forward a few years to the second kind of big moment that I wanted to talk about, where dental school just really clicked for me and it just felt amazing. A couple years later, after my first year of dental school, I entered my third year, which was, if you don't know, the first year where we were actually treating patients in the dental clinic. And this was a massive change. It was just a huge moment for all of us because we were taking all of the things that we had learned on paper and we were actually putting it to the test in treating patients. You're basically combining all of these different disciplines, from the medical disciplines, the pharmacological disciplines, the pathological disciplines, and all of the dentistry disciplines that we learn. You're taking all that theoretical information, all of those PowerPoints and the lectures and the learning, and you're putting it in practice. You're actually doing work on people. That is really when things got serious for me. But there was specifically a moment in my first semester of D3 year when dentistry all just came to a head and I got to see the amazing things that we can do in dentistry. I had a patient who basically didn't care much for her teeth for many years. She had a lot of decay. One of the professors at the time described it as apple core decay because all of her maxillary anterior teeth had decay on the mesial and distal, meaning the teeth kind of looked like an apple that had been eaten with the bite marks out of both sides. So she had a lot of decay and basically she was not happy with the way her teeth looked. Even the teeth that didn't have active caries had white spot lesions. Her gums were super unhealthy. Overall, it was just one of those scenarios where she needed multidisciplinary intervention. And that's what she came to me to have done. It was really exciting. And at first it was a bit monotonous. You know, you're going through the steps, you're starting out with your diagnosis steps and you're taking radiographs and then you're doing treatment planning. Then you're getting into perio and you're doing all of these, you know, SRPs and diagnosis and stuff. And then you get into some operative and you start, you know, shade matching and sort of envisioning the direction that you're going in, working on making sure the fillings, especially in the anterior region, are very aesthetic and cosmetic looking. But all of this came to a head for me when I got to do 4 maxillary anterior crowns on this patient. It was amazing. I did 4 crowns from 7 to 10. I did them in Emacs with our CAD-CAM machines at school, so I was able to do the CAD-CAM workflow. I actually did all 4 crowns in one day, which was pretty incredible. Because of the CAD-CAM and because I was able to schedule her both morning and afternoon, I was able to do all of the preps, temporize, and finish the crowns and deliver them in the afternoon. So basically we transformed her smile in one day. There were so many things about this experience that were awesome. I got to work with one of my favorite professors, Dr. Tom Patterson, who is a CAD-CAM genius. He is absolutely the man. He's one of the people that has made the most impact on me and my experience here at school. I got to do CAD-CAM dentistry, which I did a lot of that as a D3 and I really loved it. The ability to scan preps, to have the preps on the computer in front of you and to have the patient in the chair and to be able to compare what's in the mouth with what's on the screen, go back and forth and make any changes to the scans if needed. I love that process. Of course, then milling the crowns and delivering them the same day. The patients think it's super cool and it's really just an overall unique and smooth workflow. But really all of this came together when I took case photos of this case. I took pictures of her mouth before any of my work had been done. So before perio, before operative and all that. And then I took pictures after we delivered the 4 crowns. And when I sat down and compared the before and the after, I was shocked at what I had done. Thankfully, I got the patient's permission to share those photos with all of you. So this is what the case looks like. You can see the before and you can see the after. It was pretty incredible to get in there and see exactly what dental work can really do, the impact that it can have. And it wasn't just the crowns and them looking really good compared to what she had before, but it was also seeing how her soft tissues had repaired and healed after our perio intervention. A lot of us talk poorly about perio. It does feel at times like a bit of a roadblock in dental school, but when you get to see the positive impacts of SRP and cleaning people up, it is pretty awesome to see them in before and after photos. It's just this whole case, like I remember sitting back and thinking, I cannot believe like I did that. I can't believe that. It's crazy because, you know, you just learn all of this stuff. You spend so much time thinking about it and trying to, you know, master it and then getting to do it on a patient and actually making that big of an impact. It is super, super special. And it is probably one of the most amazing things that has happened to me in the past 4 years. That's why I wanted to share it in this video. The third moment that I wanted to talk about in this video where dental school all felt worth it isn't actually even one moment, but rather 4 weeks of dental school. So Smith, my clinic partner, and I, one of my best friends here in dental school, Smith and I have gone on 2 trips in dental school. As D4 students, we have gone on 2 clinical rotation trips. Thankfully, I brought my camera along with me for a lot of those trips, and I have vlogs that you can check out right here, covering our Knoxville rotation and our Union City rotation. Those are the 2-week clinical rotations that we have done, and both of them were unique in their own ways, amazing in their own ways, and I just wanted to talk more about them in this video. Our first clinical rotation was to Knoxville, and clinically, I would say this rotation was not as fruitful as the second one. Like, I don't think we did as much dentistry or learned as much on that rotation, but it was such a fun 2 weeks. Like, it was probably the most fun 2 weeks I've had in dental school because I was there in Knoxville with my clinic partner Smith. Knoxville is one of my favorite places on the planet. I went to undergrad there, UT Knoxville. So being back there, basically living on the Cumberland Strip there in Knoxville, and also being there with one of my best friends, it was so much fun. We had fun basically every day, and we also got to do a lot of dentistry on patients there in Knoxville, which was amazing. I did in fact learn a lot. We mostly did operative, but I also did like 9 crowns in 2 weeks, which was super cool. I'm just learning like their triple tray workflow, their impression materials, and all of that. It was an amazing 2 weeks. The weekend in between the two, a couple of our buddies, a couple of our other best friends visited from their rotation in Bristol, Tennessee, and we just had a ton of fun. Knoxville is an amazing place. Like I said, I can't stress enough how awesome that freaking rotation was. The second rotation was to Union City, Tennessee, which is a much smaller town, not nearly as much to do there. But this rotation was clinically incredible. In Union City, I genuinely felt like I got my first real taste of dentistry. I think sometimes in dental school, it feels like you like spin your wheels a little bit. You're kind of moving really slowly, and it often doesn't feel like you're actually making an impact or progress. But in Union City, we were seeing like 4 to 6 patients a day. We're doing a ton of dentistry. I learned so freaking much in 2 weeks, and it really did feel like the first time where I was like, okay, I'm in this profession. I'm gonna be a professional here very soon, and I'm just gonna be hitting the ground running and learning rapidly as things move forward. I also learned a ton about oral surgery for the first time while I was in Union City, and the reason for that was there were a lot of people that needed teeth pulled, and I basically was able to just go in and feel comfortable working on them and just kind of experimenting a little bit. They had all the instruments there, all of the surgical instruments that we would need, and I basically just did a lot of trial and error, figuring out which instruments I liked, which ones did what, how to use an elevator. All of these things were super formative for me, and I felt like in 2 weeks, I improved so much overall in my skills as a dentist, much more than I had in like 2 months or 4 months in dental school. So overall, these 2 clinical rotations were very different, but both of them had just such amazing memories for me. And once again, I'm super happy that I vlogged those experiences so that in the future I can look back on those good times, because some of the moments just spending time with guys, being in a place where we're all working on the same thing, we're devoting our time, energy, and effort into our craft, we're trying to get better, we're trying to help people. Those were just amazing moments for me, and they made dental school all worth it. Dental school is not easy. Like, there are just days like today when things are hard and things don't go like you think they're gonna go. And a lot of times, like, I'll get stressed out and I'll worry about the overall big picture. Right now, I'm worrying about graduating, you know? In the past, it was worrying about getting this grade or that grade or finishing this project. At every stage in the game, there's going to be hardships in dental school, but I think we have to step back and we have to realize what a blessing it is to pursue this dream that we all have, to get into this profession, to learn it, and to start impacting lives. I mean, I cannot tell you how awesome it is to have a patient tell you what you have done for them is better than what any other dentist has ever done for them, and that you've treated them the right way. Like, having that human to human connection is so rewarding, and I'm super happy and excited that I get to do it for the rest of my career. So anyways, I've rambled on enough. Those are 3 things that I really wanted to talk about. I really wanted to just dive into a little bit more and tell you about. I hope you enjoyed this. I hope this was informative for you. And I hope this gives you something to kind of look forward to if dental school is in your future. I'm so blessed to have done all of this. I feel like the channel these days is me just talking about how blessed I am, but it's true. I'm excited to move on to the next step. But for now, dental school has been an interesting 4 years. Stay tuned. There's still a lot to come in dental school over the next couple of months. I'm not quite there, but I'm really close, guys. I'm very close. Anyways, thank you all so very much for watching. I appreciate you all for being here. And as I always say at the end of my videos, I will see you in the next one.